Good morning, everyone. My name is Khalifa Trey Manning, and today I will be discussing spinal bifida. Spinal bifida is a congenital neural tube defect that develops very early in pregnancy. The neural tube is a structure that eventually forms the brain and the spinal cord. Normally, it closes within the first few weeks of fetal development. However, when this process does not occur as it should, an opening remains in the spine, resulting in a condition known as spinal bifida, according to the National Institute of Neurological Disorder and Stroke. From a neurological biological perspective, this failure of closure interrupts the development of the central nervous system. And because the central nervous tubes closes between the first 21 to 28 days of gestation, any disruption during this critical window can lead to long-term neurological impairment. This is why SB, I will just make that acronym for short, spinal bifida, is considered a disorder of early prenatal development. The severity of SB can vary from person to person. In some cases, the condition is mild. In other cases, it's very severe. However, in the severe cases, individuals with this form will likely experience significant physical disabilities, and they need long-term ongoing medical care and support. Research continues to show that adequate amounts of folic acid intake before conception during pregnancy can significantly reduce the risk of these neural tube defects. And because the neural tube closes within the first month of pregnancy, often before a woman realizes she's pregnant, healthcare providers recommend that women within childbearing age, they consume sufficient amounts of folic acid to mitigate the effects of these long-term disorders. A recent narrative reviewed by Leggett and colleagues 2024 reinforces the importance of folic acid supplementation as one of the most effective preventative measures of neural tube defects, including spinal bifida. The effects that this neural tube defect will have on the parents is that they infect the entire family system, both parents and children equally. The parents experience emotional distress, fear or grief, stress with medical appointments, ongoing surgeries and therapies, financial strain, role overload from caregiving responsibilities, and the children will experience social challenges due to physical limitations, emotional frustration, even peer pressure at school, and lowered self-esteem. They suffer from chronic pain and fatigue, or one or the other. Difficulty with independence requires behavioral health support from caregivers. And according to McWhorter and McIntyre 2021, they have found that parents of children with these developmental delays often experience elevated levels of stress and anxiety. And so religious and spiritual encouragement serve as protective factors, helping them cope with uncertainty, to find meaning, and even find hope in their lives. These are especially relevant to families navigating spinal bifida, as the condition requires long-term adjustment and adapting for emotional support and care. Implications: counselors work with families affected by spinal bifida should consider several important implications. They should consider psychoeducation, emotional support, and to have a family systems approach with this disorder. Advocacy and resource navigation is something that they should be involved with in order to keep themselves updated as to what's the better service of care they can seek out to help support the child and to help support themselves. I hope that this video had provided you with an informed amount of information as to why it's important to take preventative measures and to look for early interventions, and supportive counseling why supportive counseling is so important with individuals suffering with spinal bifida and other neural tube defects. Thank you.